I risk a lot doing this. I live in a small town. My husband's a lawyer, well-known lawyer. I'm pretty well-known. And we debated about whether or not to be open with this because so few people truly understand. And you get labeled, and it affects the ability sometimes to get jobs because people in the medical profession don't understand. And I happen to be a nurse. All of that was overridden by my sincere and utter gratitude to Dr. Boyages and his staff for saving my life, and to reach others who may be in the same condition that I was in, the same suffering and pain that I was in, who know nothing as I knew nothing about this treatment. If I can reach one person by doing this, whatever negative effects occur as a result, it will have been well worth it. It will have been time well spent. My name is Marie, and I am a recovering depressed person, is the best way I can put this. I am speaking with you today so that I hope to be able to assist others who suffered as I did to find alternate ways of treatment other than the medications that are currently the primary treatment for depression. I came to Dr. Boyages' office maybe about 3 months ago, and I had just endured a year of treatment with traditional medication and was not capable of even doing psychotherapy because my level of depression was such that I couldn't even talk. I spent the better part of that year in a chair, unable to really do much of anything except occasionally get dressed, take a shower, and go with my husband to the grocery store. Literally, I lived for a year in hell. I was suicidal. I was in so much pain that I can't even begin to tell you the suffering. And unfortunately and sadly, most people don't understand the suffering that one who goes through depression feels. It's just like in Cher and Moonstruck, snap out of it. And they don't understand that it's a brain disease, and they don't understand that it's a life-threatening brain disease. What it was like experiencing TMS. The procedure takes 6 weeks. I wasn't really nervous about it because at the point when I walked in the door, I was just a shell. I didn't really care whether it hurt or it didn't hurt. The application of the whatever it is they put on your head to make it work is painless. You don't feel it. The chair is extremely comfortable, like a very comfortable and a very expensive dental chair. The staff makes sure that you are in a very comfortable position. The actual stimulus is, at first, it sounds a little bit like a dart gun. It's da 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 da, like in a World War II movie or something. It feels like, well, it's been described, and I guess the best way to describe it is like if there was a woodpecker right here sitting on your head, kind of woodpeckering at your head, that it is not, initially it is a little uncomfortable. What I found is that after a while, I actually looked forward to it. Because maybe it was because I thought that something was happening to change my chemistry or my brain. By the end of the final week, I was a different person. I really was. I mean, everyone I knew, you know, they didn't know what was going on. I mean, they'd been seeing me walking around like a zombie for a year, and then suddenly, you know, I'm back to being Marie again. I mean, people were, you know, stunned, as was I, actually. I am able to use the tools now and to live a successful life, back to being the determined individual that I was. I'm coping. My husband has been ill. I've been coping with multiple hospitalizations. I have a lot of life issues that would depress somebody who didn't suffer from depression that I'm coping with. I actually am happy most days. Some days, part of the day. I never believed that I would feel joy again. I had forgotten what that felt like. I like to talk to people now. I enjoy seeing people now. I'm increasing, my social life is expanding. My life is changing slowly in ways that make you want to be alive. Life isn't sitting in a chair in psychic pain so dreadful that you just feel like you're in a dark hole. That's not life. Life is smiling and sailing and picnics and walks and friends and loving your husband, and that's life. And that's the Marie that you see in front of you today. But the inventor of this machine, the neuronetics people who manufacture this machine, and mostly Dr. Boyages and Jen, are responsible for really, truly saving my life. And I don't know how you say thank you for that, but I guess the best way to do it is to live a happy and successful life. And that's my plan, one day at a time. And that's all I've got.